Hi, my name is Robert Chelle with Chelle Law, and I'm an attorney that assists dental associates with employment contract and independent contractor agreement issues. Today I'm going to talk about dental associate compensation basics. What are the standard types of compensation structures used for a dental associate? And then some red flag areas you need to think about as well. So, first, straight base salary, I would say less common in the dental industry than almost any others. Maybe if you're working for like a DSO type organization, they'll use a straight base salary or some corporate dental type stuff. But obviously, it's very simple. You work your hours, you get paid a set amount, and that's it. So that's the easiest thing. I don't think we need to discuss that. Next would be a daily rate. This is also very common, especially for new dental associates, meaning you work your 8 or 9 hours, you get paid a set rate, and that's it. Now, two things to think about in regard to a daily rate. One, you're not going to get paid time off, most likely, meaning whatever, however many shifts you work, that's how much you're going to get paid. And then it's unlikely they're going to raise your daily rate much over time. When you come in, I think people are surprised at how little people get raises once they begin, and certainly almost never baked into the contract that your daily rate will increase over time. Daily rates absolutely, vary kind of widely based upon specialty, geography, what the clinic is like. So you need to do some due diligence and just see what are some of the standard daily rates in my area, and doing what I'm doing and just making certain that you're not getting taken advantage of. Next would be collections. So probably the most common would be the dental associate gets a percentage of the collections the practice receives based upon the dentist's personally performed services. Usually somewhere between 30 to 35% would be a standard amount of collections for a dental associate. What you want to make certain is that you have some kind of guarantee for the first, I would say, year, at least 6 months. And how a practice would normally do that is they either just guarantee you like kind of a base salary for the first 6 months, and then you would transition into collections. The more common one would be a daily rate, where they would take the greater of, so let's say your daily rate's $750, and then every month they would reconcile how much the practice brought in based upon your collections, do the let's say it's 35%, and then if that number exceeds whatever they paid out via your daily rate, then you would get a bonus at the end of each month. That's a normal way of doing it. And then when you transition out of that guarantee period, it's purely what's collected on your behalf. So every 2 weeks, every month, whatever the kind of interval is, they do a reconciliation, and then you get paid the percentage of whatever the practice has collected on your behalf. Now, one absolute thing that needs to be in your contract, if you're paid on collections, and this varies a lot, if it's a heavy dental insurance practice, not fee for service, or perhaps Medicaid as well, there's going to be a gap in between when you provide care to a patient and then when the practice receives the money. In some collections contracts, when it's purely collections, there will be language that says you get no compensation after the contract terminates. So after your last day of employment, that's it, you get nothing else. But if you think about it, if you're on collections, let's say it's a 30-day accounts receivable cycle for an insurance claim. Well, for the last month that you're working, none of that money is going to come in until after you've left, after your contract terminates, and you have essentially worked for free for the last month of your employment with the employer. You can't have that. So you need to have language in the contract that states you will get, I'd say, a minimum of 90 days of trailing collections, meaning any of the collections that the practice receives over the 90-day period after it is terminated, you will still receive credit for and get that money. It is only fair that if you have done the work that you will ultimately get paid for it. Now, many practices don't want to extend out like an indefinite period of time, simply because it's kind of annoying to have to account for all these claims that trickle in, 9 months later. So it's not uncommon for them to cap the amount. Sometimes you'll see, kind of all of the stuff that you've done, you'll get credit for. But that's a huge thing that needs to be in the contract if you are paid purely on collections, which is probably, I'd say, the majority of the dental associates that I work with and review their contracts. So those are some dental associate compensation basics. If you have any questions about your compensation, an employment agreement, independent contractor agreement, feel free to contact my law firm at the information listed below in the description. And I appreciate you watching the video. All right, thanks. Take care.